Hello, everyone, and thank you so much for joining us this evening. My name is Michael York, and I will be your moderator for tonight's webinar. We thank you so much for joining us. And if at any point you do have any questions that come to mind throughout tonight's topic, please feel free to utilize that question and answer function and/or the chat function, whatever is easiest for you down below in your toolbar. We'll make sure to open up a kind of a question and answer session towards the end of tonight's presentation, where we can kind of go ahead and address any things that may have raised an eyebrow or you have questions about. And we have a wonderful presentation on hand tonight entitled Visual Freedom: Unveiling the Benefits of LASIK, which will be presented by our very own Dr. John Hovanesian. Dr. Hovanesian specializes in cataract, refractive, cornea, and pterygium surgery with Harvard Eye Associates, so has a very extensive knowledge on tonight's topic. Just some quick background about Dr. Hovanesian, or Dr. H, as we lovingly refer to him as at Harvard Eye. He received his medical degree from the University of Michigan Medical School, after which, go blue. After which he completed his residency at Henry Ford Hospital in Detroit, where he served as chief resident. After his residency, Dr. Hovanesian completed a 2-year fellowship in refractive and corneal surgery at the Stein Eye Institute at UCLA. Recognized as one of the top 35 surgeons in the country by Newsweek, and named one of the world's 100 most influential people in eye care by the ophthalmologists. I will pass things on to Dr. Hovanesian for tonight's webinar.
Well, thanks, Michael. It's a pleasure to be here. And thanks, Erica, also, and our team for putting this together. Appreciate everybody coming and joining us for a fun and really exciting topic. It's one of our favorite things to do in the office, because we love at Harvard Eye transforming lives for the better, and with great technology. A lot of people don't know it, but here in Orange County, we are in the middle of the Silicon Valley of eye care. And here, there is more development of new technology in eye care than any place else in the world. And so our doctors get to use technology, and we're aware of technology well before other doctors have even heard of it. And that means that when that technology is well approved and proven safe and effective, we can give it to our patients with the expertise of not just passively understanding, but really having participated in many cases in the development of the technology that's new. And we really do that. So I'm going to share with you some slides on tonight's topic, which is all about visual freedom, and unveiling the benefits of LASIK is really one of our favorite topics. So hopefully everybody can see that screen. Looking forward to a lot of people, it's kind of a dream to think about what it would be like to live their life without glasses. People have many different motivations. I've had patients who wear thick glasses and they worry about functioning in an emergency. They wonder about, what would happen if I had to save my child in the middle of the night and I couldn't find my glasses, if I had to get out in the case of a fire, all sorts of reasons. But of course, the question of whether LASIK is right for you is somewhat of a personal one. There's a personal side, there's a technical side, there's a financial side as well, and it's best to understand it, and then we really suggest that we want to make it easy for patients to find out without a sales pitch whether it might be right for them. And so we have a process where patients can come in for an evaluation. We don't charge anything for that. So we can examine the eyes and determine what they're, whether they're a candidate, and advise them on what they could expect. And then if they want to proceed, great. And if they don't want to proceed, that's great too. We want what's right for our patient as a first priority. It is a great alternative, LASIK, for those who want to rid themselves of glasses and contact lenses, because in most cases people can do that. LASIK has been around since the early 90s, and it has gone through a lot of change during that time. I trained really at the end of the late 90s. I finished my fellowship in refractive surgery when LASIK was fairly new, but it was around the year 2000. And have been part of the evolution of that procedure ever since then. So we can treat almost any type of vision problem that you have. If you're nearsighted, if you're farsighted, if you have astigmatism in your eyes, if you have a mixture of astigmatism and nearsightedness or farsightedness, that is all correctable. And some people don't know that because they've been told that some of those corrections are not possible. They are possible within a range of what the laser can treat. So there is such a thing as having your eyes be too outside the range for LASIK, but there are other procedures that can be done in those cases. So the kind of things that we look for, number one, to be a candidate for LASIK, we want to see that your eyes are not changing significantly. If your prescription is changing a little bit from year to year, which is super common, it is going to be not a problem, because sort of like if you measure your shoe size from year to year, or on a different pair of shoes, you might find a slightly different measurement, but really your foot's probably not changing a lot over that time. Your eyes too. Once you're past about age 18, any changes in your eye that happen while you're growing up tend to slow down or stop. Now, some folks into their 20s have changes, and we can usually tell if that's the case. So we would encourage you to wait if that's happening. And of course, the other thing we look for is we want to make sure your eye's healthy before you go through any sort of elective procedure. We want to know that you don't have other problems. And really, all of that we can detect through the exam that we do in the office. So there have been over 20 million people who've been through LASIK in the United States. That is, speaks volumes to how safe and effective the procedure is. The FDA has approved the procedure long, long ago, and they've also approved updates to the machinery that we use, the technology that we employ to make it safer and better. Now, all of the precision steps of the procedure are done with lasers, so that you can be assured that no human hand could be as precise as the treatment that is given by the by the lasers that we're using. And we use something called wavefront-guided technology. Now, most people aren't familiar with this, but think about the way we measure your eyes for glasses. There are 3 numbers that we use to give a glasses prescription. Well, there are about 60 numbers that we use to describe how we measure the eye and then treat the eye with wavefront-guided treatments. In other words, it's a lot more sophisticated. Instead of like prescribing a pair of glasses, it's like the Mir space station. The optics that are used there are the very same type of optics that are used to give patients really the very best vision we can, and that really does translate to better visual performance in tough visual situations like driving after dark. And that's why it is such a satisfactory procedure, why the vast majority of people really are pleased with their outcomes. It helps to kind of understand this, to put in perspective how your eye sees. And the eye is like a camera. And we think of light rays as coming, we primarily think of them as coming from, let's say, a long distance away. And that means that the light rays are coming in all parallel to each other. And then the light passes through the front window of the eye, which is the cornea. And whoops, I advanced while I was pointing. It then passes through the aperture, which is a part of the iris. The iris is what gives your eye its color. So green eyes, blue eyes, brown eyes is determined by the color of the iris. And the opening in the center of that iris is called the pupil. And so light passes through there and then goes through a lens. Inside your eye, just like a camera, there's a lens. And we want to make sure that lens is clear, that it does not have cataract. You're probably not a great candidate for LASIK if you have significant cataract. Small cataracts are not a problem. But then the light is focused by that lens and by that cornea to come to focus in a sharp point on a screen at the back of the eye called the retina, like a projector screen, or you can think of it like a sensor chip in the back of your phone that your camera uses. It allows you to sense that light, and it translates it into a signal that the brain can understand. So that's the basics of how the eye works. In a normal eye with normal vision, with good eyesight, those light rays coming in from infinity pass through, and the light is focused in a relaxed state to a perfect sharp image at the very back of the eye. And so that's normal vision, if you're lucky enough to be born with that. When you're nearsighted, it's almost as if your eye is too long, or the light rays come to focus in front of that retina. And that means that the images, the light rays that pass behind that, are out of focus when they hit the retina. So you just don't see well far away. Now, nearsighted people, you can kind of know you're nearsighted if you can see things up close without glasses or contacts, but far away, it's hard to see. That means you are nearsighted, as the name implies. Farsighted is harder to understand, but it's from a standpoint of the way the eye focuses, it's really simple. It's just this. So the eye is almost as if it's too short. And that means that the parallel light rays coming from far away are focused through the front of the eye, but they don't quite have enough focusing power to bring those rays together on the retina. It's as if the eye is too short. And what this usually means when you're a youngster, and that means, let's say under age 40 or 45, your eye can compensate for some of this. And it does so because the lens in the eye can flex and bring that point of focus up to the retina. So a lot of people who are farsighted actually don't know they're farsighted. They grow up with the best vision of anybody on the block because they can see far away. Their young lens can focus and see up close. But as they age, the lens loses that ability. And so often folks who are farsighted, by the time they're in their early 40s, they're starting to wear reading glasses. And even when their friends are saying, well, you need reading glasses. And that's because their eye is losing that ability to overcome the shape and size of the eye. So that's what farsightedness is. And then, of course, as you get older with farsightedness, it becomes even more difficult to see. So even far away objects become out of focus. So it's kind of a frustrating problem because you start out with good vision, and as you have birthdays, your vision gets worse and worse and worse. And so we love fixing this problem because people are super happy because they will forever hopefully have much better vision. What is astigmatism? Just to clarify, a lot of people think I have astigmatism. No, it's one word that starts with an A. It's astigmatism. You have astigmatism, or you don't have astigmatism. So what astigmatism means is that the light rays passing into the eye are not all focused the same way. Those light rays that are kind of up and down, that are vertically oriented, or lines that you're looking at that are vertically oriented, have one focal range or one focal length, and those that are opposite, oriented opposite, it takes a different focus lens to bring them into focus. And so it's kind of like the surface of the eyeball, instead of being round in its shape, is sort of oval in its curvature. Another way to think of astigmatism is like, what's the difference between a basketball, which is perfectly spherical, and a football, which kind of has a funny curvature. One side of the football, one way the football has a tighter curvature, the other way it's kind of a more gentle curvature. That's astigmatism in the eye. And so it takes special lenses to correct astigmatism. It's correctable with eyeglasses, it's correctable with contact lenses, and it's correctable with LASIK surgery. So that's astigmatism. And a lot of people have some astigmatism on top of their nearsightedness or farsightedness. So what LASIK does, in the simplest sense, is it takes that prescription that you have, that difference between your eye and a normal eye, and it puts that contact lens or glasses prescription directly on the surface of the eyeball permanently. So to do that, we have to measure the eye and then deliver that prescription correctly. And that's exactly what we'll talk a little bit about. There are 3 steps that we do. The first step happens in the clinic, and that is where we create a map of your eye. And that map is like if you've ever looked at a topographic map of a mountain, and you have different parts, the highs and lows of the mountains are mapped out with lines they call contour lines on that map. We do an optical version of that to show the different areas in the eye and how they focus. The second step, and we do that with a machine that essentially creates this 3D map. And it is far more precise, as I mentioned earlier, than the measurements we use to prescribe glasses, where we just kind of put lenses up in front of you and say, is 1 better or 2 better? And it makes people crazy because sometimes 1 and 2 just look equally bad. And doctor, which one is it? You tell me. We do that because, sometimes there is almost no difference between the different lens powers. Here, though, we measure it with much greater precision, and there are repeated measurements done. So you don't have to say better 1 or better 2. The machine is looking, and the machine knows which one is better for you. And it does so with a lot more resolution than you ever could. The next step in LASIK is to prepare your eye. And we, on the day of the procedure, we use numbing eye drops. They have a little bit of sting the first time they go in, and then they don't anymore. They're not painful. No part of LASIK surgery is painful. And we use an instrument, a laser instrument that creates what we call a flap in the cornea. And I'll I'll show you a little bit more on that in a moment. That flap is basically where we take the surface layer of the front window of the eye, the cornea, and lift it out of the way so we expose the inside layers. It does not hurt. And the whole LASIK procedure takes about 10 minutes for both eyes. Then we deliver the treatment. The treatment is done with another laser that is right side by side. So you're lying down as you see the patient here doing. The surgeon is right there with you. And I always work real closely with patients, making sure we take our time so that you don't ever feel like you're uncomfortable or not in control, and explain what we're doing, not in more detail than you need, but in the right amount of detail so you can understand that things are moving along nicely. And help our patients get comfortable with it. There's lots we can do to do that. We treat lots of folks who are really scared that they're going to do something wrong, or that, something is going to happen. And, we've done this so many times for so many patients. We've just developed experience with thousands of people in how to make it comfortable, how to make it safe, and how to give you fantastic vision along the way. So, what to expect from your perspective if you're going to go through the procedure, again, is first a visit where you come to the office. And this is what I talked about earlier. We don't charge for this. You can be there as long as 90 minutes because we often dilate your pupils. Do we have to do that? No. But it really helps us if we're going to use them, if we're going to plan the next step to be surgery. It helps us to really get a proper exam of the eyes to get really good quality measurements. So it is right to do it at some point before your LASIK surgery. Now, if you wear contact lenses, it is fine to wear them that day if you really must because you're coming from work. Ideally, if you wear contact lenses at some point before your procedure, we like to have you leave them out for a week if they're soft contacts, and 2 weeks, and sometimes longer if they're hard or what we call gas permeable contacts. Why is that? Because a contact lens, as gentle and wonderful as it is on your eye, can change the shape of your eye. And in a temporary way, it can alter your prescription. So, but after a period of time that I just mentioned, that will go away. So we don't want to treat your eye based on the wrong measurement. We want it to be the right measurement. So we like to have the lens off long enough that your eye reverts to its natural shape so we get it right for you. In woodworking, there's an old expression, measure twice, cut once. We measure about 65 times to do the procedure once. So we want it to be just right for you. On the day of the procedure, we have medicine that we can give you. Most people are a little nervous. Most people take a gentle tranquilizer pill. It doesn't knock you out, but it makes you just feel a little more chill, a little more relaxed and okay with what we need to do. And we encourage you to do that, but we don't require it. I mentioned the numbing drops. And there are some parts of the procedure where you may feel a little bit of pressure, and it's just kind of like pressing on your forehead or pressing near your eye. It's not uncomfortable, but it's a sensation you may not be used to. And normally we will do one eye and then the other eye right afterwards. We don't require you to do that if you feel more safe doing it otherwise, but about 99% of LASIK performed in the world is done on both eyes at the same sitting because people want to have it over with. They want to move on with their lives. After the procedure, we give you a couple little shields that go on your eyes, just really mainly for when you're sleeping at night for the first few days. It is safer just in case you unconsciously rub your eyes afterwards. You're not going to do any great damage, but you could slightly wrinkle the surface flap in the cornea, which wouldn't damage your eyes permanently, but it might require another procedure to smooth things out, a very simple procedure to smooth things out. It's always better if you heal in one go without any, complexities or interruptions. So wear those shields for the first few nights. And on that day, you do want a driver to bring you home because we've given you that mild tranquilizer. The best thing you can do when you get home is to sleep for a while. We'll give you some eye drops. But if you can sleep through your dose, go ahead and sleep, because the best thing is to sleep. When you wake up, you can catch up on your medications. We'll also have you use some lubricating eye drops, just like artificial tear drops, just to smooth the surface of the eye to keep you real comfortable so that you won't be, you won't have a scratchy feeling. It's really normal to have some blurriness. It's normal to have a little fluctuation. So let's finish with a little talk about the eye LASIK technology we use. We use a system called iDesign that actually is created by Johnson & Johnson Vision, the most trusted name in healthcare. And this has gone through such great evolution at measuring the eye with a 100% personalized treatment. It is, the treatment you receive will not be like anybody else in the world because it's customized to your eye. And we use a IFS, which there's no blades involved. The laser creates tiny separations in the tissue that we connect together, and it is far more precise, far stabler than any other method. And then we use a laser that actually reshapes the tissue called an excimer laser. And this is just such a well-proven, trustworthy machine that verifies which eye we're treating. It corrects for small motions of your eye. If you blink your eye, which you can't do because we use a very comfortable device that helps keep it open, it's not going to be a problem. It makes sure using an iris fingerprint that it's the right patient, and does all kinds of space age stuff. Believe me, we double check all that stuff ourselves, but it's nice to have a laser that's thinking on its own as well, so that we do things the right way. So finally, why would you consider LASIK? Well, it's kind of ending with what we started with. The freedom that you can achieve is remarkable. The vast majority of our patients are not 20/20. They're better than 20/20. They're better than they saw with glasses or contact lenses. The majority achieve 20/16 vision or better, and have no trouble driving at night or doing other visually challenging tasks. It's wonderful because it's freedom from the type of corrective lenses that so many people have been dependent upon, and it's wonderful because there are a few things we can change. If I had it to do over, I'm not sure I'd want more hair, but because I kind of like the simplicity of getting out of bed and having my hair look just like it did the day before. But there are very few things we can change about the way we are that make us physically more perfect. And LASIK is one of those procedures where truly we can improve on what God gave us and have a better life as a result. So it's a technology that I'm a big believer in, and encourage you to consider it. Having said that, not everyone's a candidate for LASIK, and there are a couple other alternatives that we sometimes use. PRK on the right is a very close cousin of LASIK, and so I won't spend a lot of time there. The only difference is we don't create a flap, but it's the same laser, it's the same technology in every other way. EVO ICL is a technology for some people that is an alternative if you're not a candidate for LASIK, and that's something we can discuss if you come in for an evaluation. It's a wonderful technology that allows us to put something that is called a implantable contact lens inside the eye, and it is exactly like that, a contact lens that goes in and does not ever need replacement until perhaps you're old enough that you develop cataracts, and then we can remove it and do normal cataract surgery with no problem. So these are the great options that we have. Comparing these, we won't get into the details of because it's not that important. But one thing that some people like about the EVO ICL compared to LASIK, although it takes a little bit longer to do the procedure, is that it's removable. And if somehow, for some reason, it wasn't right for the patient, it can be taken out. Now, that's extraordinarily rare that we would need to do that, but it has that advantage. The lens itself also has some ultraviolet protection that some people think is a nice advantage as well. But mainly, it just gives terrific vision for people who are not a great candidate for LASIK. So next step for most of us is to find out if you're a candidate. And so you can use this QR code or contact our office. You can take a LASIK self-test on our website, harvardeye.com, and find out if your vision sounds like you're compatible with LASIK. But really, the best way to do it is in the office through a consultation with us and our staff. And so that's it. I have to jump off because my daughter is graduating high school this week, and I need to be at an event for her. But I can stay on for just a few more minutes. So maybe Michael, do we have any questions?
Yeah, we can open it up for some general questions. And like Dr. H was saying, if you do have any questions or kind of more personalized questions, you can always feel free to call our office and speak with our LASIK coordinator and specialist, Emily White. She's fantastic. She'll be the one who walks you throughout your entire process from start to finish and is often in the surgery room with you. So she is fantastic. So she'll be able to help you with questions like more specific to your needs. We do have one general question, and that is, what about dry eye? Does that affect your ability to have LASIK, or does that need to be treated prior to LASIK?
Yeah, so dry eye is a pretty broad topic that if you have extreme dry eye, really severe dry eye, you may not be a candidate for LASIK. or we might, advise something like the ICL procedure, for example. It would be a very individual question. LASIK will, in the short term, cause dry eye to be a little bit worse. It can cause a little bit of dry eye. Typically, that effect of LASIK will go away within a year. So, remember, your eyes go through a real procedure when they have LASIK, and there is some healing time. That doesn't mean you don't see well, but there can be a little bit of dryness people experience for even a number of months after the procedure. Usually not significant, and usually people are thrilled with the vision, so, it's a small price to pay.
Doesn't look like we have any more questions at the time. If you are wondering, oh, darn, there was something that I wanted to go back and revisit, you can always feel free to follow our YouTube channel. This video will be posted to that as well. You will be able to rewatch it just to kind of refresh yourself on some topics that we did address tonight throughout the webinar. But before we sign off for the evening, any last words, Dr. H, that you'd like to share with everyone?
I am happy to see you, and if LASIK might be right for you, I'd be delighted to meet you and talk about how we can help you with it. So let us know, and thanks for your attention today, Michael and Erica. Thanks very much for putting this together, and I hope it was valuable information for everybody.
Thank you, everyone, for joining. Have a great rest of your night, and Dr. H, good luck with your speech. I know it'll go fantastic.
Thanks very much. Take care.
Good night, everyone.